Indianapolis woman is dead after traveling to the Dominican Republic for plastic surgery.
Sheree Terry reflects on the life of her twin sister.
And she went to go get her body done in a DR, and she never made it back.
Rolanda Hutton will never walk again.
It's very traumatic. It's like you never think about not being able to walk.
She ended up in a wheelchair after she had a Brazilian butt lift at the Dallas Plastic Surgery Institute.
When I first woke up, they were asking me to move, and I couldn't feel my legs.
The hidden dangers of Brazilian butt lift BBL surgery. What you need to know. Welcome to the channel. Please subscribe and leave a like. Brazilian butt lift BBL surgery has surged in popularity, fueled by social media and celebrity trends promising a curvier, more voluptuous figure. However, beneath the glossy before and after photos lies a procedure with life-threatening risks, some of the highest in cosmetic surgery. These are real-life stories of women who had complications and died after this procedure. This raises the question, is it really worth it? Board-certified plastic surgeon Dr. Barrett had this to say about the safety of this procedure.
So a Brazilian butt lift is a fat transfer procedure that has the highest death rate of any type of plastic surgery procedure. The main reason why is if you inject in the incorrect plane, you can take fat droplets from your transfer and transfer them into veins that go back to your lungs and can cause death or a pulmonary embolism. We have special ways in which we inject the fat. We don't go too deep into the muscle, okay? The muscle has a fascial protection on it, and if you pierce that fascial layer and go inside the muscle, which a lot of doctors try to do, or people not even doctors try to do, you can get fat within that muscle, which yes, it does give you more volume, but it increases your risk for that fat to make itself to those big veins, right? Those big veins are protected by that muscle. So if you don't go into the muscle area, and you just stay in that subcutaneous area by injecting from the top down, not from underneath, you are way safer. Make sure your doctor follows those guidelines if you are considering getting Brazilian butt lift, and don't try to go too big, too fast.
Here's an in-depth look at why BBLs are considered one of the most dangerous cosmetic procedures, and what you should know before considering one. 1. The shocking mortality rate. The deadliest cosmetic surgery. According to a 2017 report by the Aesthetic Surgery Education and Research Foundation ASERF, the mortality rate for BBLs is estimated at 1 in 3,000, far higher than any other cosmetic procedure. Fat embolism. The leading cause of death. If fat is accidentally injected into a blood vessel, it can travel to the lungs or heart, causing a sudden, fatal blockage, cardiac arrest, and stroke. Some patients have died on the operating table due to fat entering major arteries. Linda, a 26-year-old mother of 2, went in for a BBL at a Miami clinic. Mid-surgery, she went into cardiac arrest. The autopsy revealed fat had entered her bloodstream, leading to a fatal pulmonary embolism. 2. Severe and life-altering complications. Even if the surgery isn't fatal, complications can be permanent and devastating. Infections and necrosis, tissue death. Improper sterilization or poor aftercare can lead to flesh-eating bacteria, necrotizing fasciitis. Some patients require emergency surgery to remove dead tissue, leaving permanent scars or deformities. B. Asymmetry and lumpy results. Fat doesn't always distribute evenly, leading to unnatural lumps, dents, or uneven buttocks. Corrective surgeries are often needed, increasing costs and risks. C. Chronic pain and nerve damage. Some patients report long-term numbness, shooting pains, or difficulty sitting due to nerve trauma. D. Fat reabsorption, wasted money, effort. Up to 30 to 50% of injected fat can dissolve within months, leaving patients dissatisfied and seeking additional risky procedures. 3. The rise of illegal and back alley BBLs. Due to high costs at reputable clinics, many seek cheaper, unlicensed providers, leading to horror stories. Pump parties, underground procedures in hotels or homes using industrial-grade silicone, not medical-grade fat. Amputations and sepsis. Contaminated injections have led to life-threatening infections, requiring limb removal. No accountability. Many illegal practitioners vanish after botched jobs, leaving victims with no legal recourse. Maria, 34, went to a discount BBL clinic in Texas. The unlicensed injector used toxic fillers, causing her buttocks to harden and rot. She needed emergency surgery to remove the infected tissue. 4. Why is the BBL so dangerous? A high-risk technique. Fat must be injected into the muscle, not just under the skin. A small mistake can puncture veins or arteries. Even experienced surgeons can't eliminate embolism risks. B. Lack of regulation. Unlike breast implants, there's no standardized safety protocol for BBLs. Some surgeons prioritize profit over safety, performing multiple BBLs in a day. C. Social media misinformation. Many influencers and clinics downplay risks, making it seem like a quick fix. Patients often don't realize how deadly it can be until it's too late. 5. Are there safer alternatives? If you want a fuller look without risking your life, consider 1. Exercise and strength training squats, hip thrusts, glute workouts. 2. Non-surgical but lift sculpting, RF treatments, HIFM technology. 3. Shapewear and padding instant enhancement without surgery. 4. Fat transfer alternatives if done by a highly skilled, board-certified surgeon. Final warning. Is a BBL worth the risk? You can't undo death or severe disfigurement. Thousands have died from BBL complications. Many survivors live with chronic pain, deformities, or regret. There's number 100% safe BBL even with the best surgeon. Share this info, it could save a life. Please subscribe to the channel.